Hello and Assalamu alaikum, ladies and gentlemen. Welcome to yet another episode of the Dental Talk. If you like our video, please like, please subscribe, please share our channel. It would mean the world to us. We are loving the support that we're getting so far. So, as promised, we have a very special guest with us here today. We have Dr. Falak Murad Shah. She is one of the only three forensic odontologists that are practicing here in Pakistan. She graduated from the Liaquat Medical University of Health Sciences, Jamshoro, with her BDS degree in 2016. She went for a master's to the University of Dundee in forensic odontology, one of the only universities that's actually conducting a master's in forensic odontology in the UK. She is currently working as the team member of the Kenyan International Emergency Services, which is a privately owned disaster management company recognized as the world's leader in providing crisis management services throughout the world. She also works as a lecturer at the Dow University of Health Sciences in Karachi, and she also recently worked on the PIA case and many other interesting cases in the UK and Pakistan as well. She had a lot to tell us. I'm sure if people who are not interested in the clinical side of dentistry and want to pursue some unique degrees like forensic dentistry, because there's a huge scope of forensic dentistry in Pakistan. There are only 3 forensic odontologists as of right now in Pakistan. So I'm sure you will love this video and you'll learn a lot from this video. With that, thank you so much, ladies and gentlemen, Dr. Falak Murad Shah. Hello and Assalamu alaikum, Dr. Falak. How are you?
I'm good. How are you?
I'm good, Alhamdulillah. How's the quarantine life going?
It's good. It's good.
It's good. How has
I'm
it
pretty
been?
much happy with this quarantine life.
Okay, you're enjoying it, like just
I
like the
am.
most of us. Most of us. Okay.
Yes.
So, with your permission, should we start the interview?
Yes, please.
Okay. So, first of all, let's talk about you. Tell us a bit about yourself. Introduce yourself to our audience. Tell us a little about your journey through dentistry, how you got into dentistry, and your journey through dental school.
Okay. So first of all, I'm Falak Murad Shah. I belong to Karachi. Like I'm from Interior Sindh, and at the moment I'm working as a lecturer at Dow University. I'm also a member of Kenyan Emergency Services, as you already mentioned in my introduction. Um, so basically, I always wanted to choose the medical field, but I was not sure if I wanted to do MBBS or BDS. But then I don't know if this would sound stupid, but yeah, but somebody in my school just said that, BDS karenge to direct surgeon ban jayenge.
All right.
And
Yeah.
BDS hai to easy hoga. Little did I know कि easy nahi hoga. So
Yeah.
yeah, just like that. But I always wanted to choose the medical field.
Okay.
So that's why I chose dentistry, and then yeah, just like that.
How were those undergraduate years like?
Undergrad years were really nice. We enjoyed, and I enjoyed studying the subjects from our BDS course. And other than that, the life was really nice, I feel.
Right. Okay, so we know you did a master's in forensic odontology, but we have to ask, what made you choose this specific field? Why not any other field? Did you always know you wanted to go into this field? And if not, what was that thought process that led you to make this decision to do an MSc in forensic dentistry?
So basically, I wanted to do something different. Okay, so I did not have any idea if forensic dentistry existed. Same as a lot of the young dentists over here.
Yeah.
Because when I went for my master's, I had no idea of forensic odontology, what it was and stuff. But yeah, I chose this field because it was something different. I wanted to do something different, but yeah, I had an option that I wanted to choose between pediatrics and forensic after I came to know about what forensic exactly was.
Okay.
So I chose forensic firstly because because my father always wanted कि मैं masters बाहर से करूं. So I wanted to go abroad for my masters, and then I wanted to do something which was obviously affordable for my parents, and then thirdly I wanted to do something different. So I chose this course because it was in my range, and because pediatrics was a clinical course and it
Yeah,
was kind of expensive as
yeah,
compared to forensic dentistry. So
absolutely.
yeah, I chose this. And then there was this teacher in my university. I just asked him, what should I do after my BDS in my last days of undergrad? So he suggested me go for forensic odontology, go for pediatrics, go for medical education. So I just right away tried to Google something, and then I found this course, which is actually only undergoing in this university in the UK.
Yeah,
And this course was particularly in the University of Glamorgan in Wales at
yeah.
first, from where my supervisor did forensic odontology masters. But then they shifted this to University of Dundee, and now in the UK, the University of Dundee is the only university which is undertaking this course.
All right, perfect, perfect, perfect. Okay, so we know forensic dentistry is not taught during our undergrad years in Pakistan. Some very few colleges actually take up forensic odontologist and have those lectures during the for the undergrads. Why do you think that is? And do you think it should be taught to undergraduate students throughout Pakistan?
Thank you for asking this question in the first place. I will just want you to know that we are three forensic odontologists in Pakistan. There's
Yeah,
one in Lahore, and
yeah.
we are two, me and Dr. Soman. We are here in Sindh. So we are basically working for Dow University. They appointed us as faculty for forensic odontology.
Hmm.
Um, I would want to say that we were doing our research for our masters, me and Suman both. So our research was somehow very basic, and it was related to this particular area,
Hmm.
awareness of forensic odontology and knowledge of forensic odontology. And then we have some questionnaires, and then in those questionnaires we had these questions, do you think that
Yeah,
forensic odontology should be taught in the dental school or something? Because we know it wasn't taught in our undergrad, and I am
absolutely.
totally in support of the fact that this subject should be taught. I don't know if you know that PMDC has given five, not this subject is not being taught as a separate subject, but
Yeah.
PMDC has given 5 hours for forensic odontology under oral surgery.
Okay.
Even then this subject is not being taught.
Yeah.
So there may be various reasons, maybe lack of faculty or lack of interest, or maybe
Absolutely.
it's just seem to be a burden or something, and they just want clinical subjects to go on,
Hmm.
maybe. So I'm not really sure what's the reason, but yes, it should be taught.
It should be taught. And what if you had to tell a professor why should forensic dentistry be taught? Why? What would
I
your
would
reasoning
just
be?
have a question from my end, that is forensic medicine being taught to the undergrads
Okay.
of MBBS? So forensic
Perfect.
dentistry should be taught as well.
Perfect. Perfect. All right.
Mhm.
Let's talk a bit about your work. Just briefly describe to the audience what your work is like.
Okay, so I can also give you a link to a video which I had made when I was in Dundee. It is all about forensic odontology. It's available on YouTube.
Yeah.
But yeah, I can just briefly tell what it is. Basically, we have two sectors of forensic odontology. So it's civil sector and we have criminal sector. So in
Okay.
civil sector, we have everything related to medico legal, that is um, lawsuits,
Yeah.
litigation, dental fraud, negligence, malpractice, and stuff. So
Okay.
this all is under the umbrella of civil sector. And then we have criminal sector,
Hmm.
under which we have abuse cases, bite marks cases, and then we have single identifications of the bodies. Then we have disaster victim identification. We have age estimation. So we have loads of work to do.
Yeah.
But then again, further in forensic odontology, these branches have some specialists. So everybody is
Okay.
not specialized for everything, and we have particular paths, and we need to select our particular area where we want to work
Okay.
with.
Okay, so
Yeah.
forensic odontology के अंदर भी there are so many specialities that
Yes.
people can actually work on. Okay, so that's what your
Yes.
work basically is. All right, now
Mm-hmm.
let's talk a bit about the younger generation. What would your
Mm-hmm.
advice be to a young dentist who is not interested in the clinical side of dentistry, just like you, wants to do something unique and wants to pursue a unique field? What problems did you have to face when you decided to go for forensic dentistry, and how did you deal with those problems, and in the light of those problems give advice to the young dentists as well?
To be very honest, I would not want anybody to not practice dentistry. If you are studying dentistry, you should be practicing. I myself am not practicing. I do not have any private clinic at the moment, but I plan to have one in the future. Okay. But if you are not interested in clinical side and you want to do something different, choose academia. Stay there, work on research because research is the future for now.
Yep.
I myself am working, I'm writing articles, I'm working on research, I'm trying my best. I get opportunities where I can just go for as a motivational speaker for my subject. I want people to be aware of forensic odontology. So I'm working in that field. I would not say that I'm a perfect clinician, but yeah, I am a dentist and I would want to be a dentist and then I would want to be a forensic dentist.
All right. So
Yeah.
just about the, did you have to face any problems when you went for your
Not
master's,
really, not really.
or any
I
setbacks? Mhm.
Not really. The thing is, I did not have any idea, and
Mhm.
like I don't know if many people from my university had gone abroad for masters or something, or they have
Yeah.
chosen this field. So I
Okay.
don't really think so. I just wanted to go through the procedure and stuff. And then I had a lot of students from Pakistan asking me, what is the procedure,
Yeah.
what is the fee structure, and how did you apply, what did you do, kya kya kiya, kaise kiya,
Okay.
undergrad ke baad kiya, house job ke baad kiya and stuff. So yeah, I'm always available to answer any kind of those questions. And if anybody needs any help regarding forensic odontology or going abroad and studying of something in dentistry, so yeah, I'm always there to help. So you
Perfect.
can contact me anytime. Yeah.
Perfect. All right. So let's talk a bit about the job opportunities and the prospects of this degree over here and abroad if you get into this field. Just briefly describe the job opportunities and prospects that a forensic odontologist can have from Pakistan over here or abroad.
So basically, if I see, as I have done forensic odontology from UK, my supervisor suggested me that I should go back to my country and serve my country. That is all I wanted to do from always. I wanted to
Yeah.
just come back. I never wanted to settle in the UK
Mhm.
and work over there. But yeah, the thing is, this field is very crowded outside of Pakistan or outside of Asia, I would say. We've
Okay.
got a lot of forensic dentists in India. We've got a lot of forensic odontologists in Australia, UK, America,
Okay.
Canada, and stuff. I would also want to bring the focus of everybody to a point that our council or the authorities should work on appointment of forensic dentists in the disaster team, in the disaster victim identification team,
Yeah.
and then we should have a proper checkup for the dental documents, and then we should have a proper council. Just say India and UK, they have their forensic odontology associations, I must say,
Okay.
or communities type of things. और हमारे पास ऐसा कुछ भी नहीं है, so we need to
Absolutely.
work on that. Yeah, we need to work on
Absolutely.
that. उस हिसाब से if I see कि यहाँ पर स्कोप बहुत ज्यादा है, because यहाँ पर फोरेंसिक ओडोंटोलॉजिस्ट है ही नहीं. ठीक
Yeah.
है, एंड देन पीएमडीसी के हिसाब से this has been chosen as a specialty. I must say,
Yeah.
क्या उसको कुछ अलग से स्पेशलिटी दिया
Yeah.
हुआ है, जैसे रेडियोलॉजी
Yes.
एंड देन
Yes. Yes. Absolutely.
फोरेंसिक एंड पीडियाट्रिक्स, सो they have kept this as a specialty अलग से. So we need staff for that, no? So we have a
Yeah.
lot of opportunities. It's just that the authorities should start working on it. And
Because there's this there's also this rumor. I don't know if I should call it a rumor or not, because it's being said that within the next 1 to 2 years PMDC will make it mandatory for forensic dentistry to be taught as as a sole subject among all dental colleges of Pakistan. So I'm
it
sure the
should be. And mm, yes,
so
please
I'm
go ahead.
so I'm sure the job prospects will obviously increase in Pakistan for forensic dentistry as well.
Absolutely, absolutely. And that is why I have been receiving a lot of messages on my LinkedIn, on my email. I do not use any other social media things. So yeah, I have been receiving a lot of messages from different students from KPK, from Lahore, Punjab, from Sindh itself. But I have been telling everyone, you should go for it, because everybody is really tense कि हमें ही करना चाहिए, नहीं हमें job मिलेगी या
Yeah.
नहीं. So you
Yeah.
should do it. And as हमें हमारे जो हमारे एक ट्यूटर थे डॉक्टर शाहजहान, उन्होंने हमें पुश किया कि हमें कोई डिफरेंट सब्जेक्ट करना चाहिए.
Hmm.
He gave us an idea कि go for forensic, go for pediatric, उसी तरह I would want कि मैं किसी को idea दूं कि हाँ, you should go for it. I would also want to tell you that we have two students from KP, I guess. Yeah, they're from Pakistan basically, and they are pursuing this course in Dundee at the moment. So yeah,
Okay.
we've got two more forensic odontologists coming.
Perfect, beautiful. All right, so my next question is something that I have been asking every dentist, and it's about this pandemic, the COVID-19. We did not know that a pandemic like this would hit us, and we just did not see it coming, right? In your opinion, what do you think is the future of dentistry, and how has this specifically affected your work, if at all?
See, as I already told you, I don't run a private clinic, so
Yeah,
I'm not a clinician at the moment.
yeah,
But as I am in DAO, I come under oral and maxillofacial surgery. So I am there in the OPD of surgery. So there are patients coming, but I must say that the flow of patient has decreased like a lot.
yeah,
And then I've got colleagues who keep on saying that patients बहुत कम हो गए. So according to that, I feel कि हाँ, because हमारा काम इतना delicate है and we
yeah,
are associated with the patient like so much, so we have to touch the patient and we
yeah,
cannot work without that. Protocols leke and working up to the mark would be very nice, but yeah, this pandemic has affected dentistry like a lot.
yeah,
But as I tell everyone, that this is the new normal. We'll have
yeah.
to adjust and काम तो हमें करना ही है. So yeah.
Absolutely, absolutely. And what about your specifically from forensic odontology? Did it affect
The thing is,
anything?
no, I would want to tell you that I worked for this PIA incident.
Yeah,
We identified 14 bodies with forensic odontology.
yeah,
So when
absolutely,
we were working, Corona was on its peak,
exactly.
and we did not find any kind of difficulty. We
Okay.
had all our PPs, we had everything, but we just continued
Okay,
working on the
perfect.
dead bodies, and we worked, and yeah.
Perfect. All right, so we're moving towards the end of this interview. My next, because
Mm-hmm.
you've brought up the PIA incident, a very sad incident indeed. Um, I
Mm-hmm.
would like to ask you, have you ever worked on any interesting cases recently, apart from the PIA case, obviously, and obviously you worked on
Mm-hmm.
cases in the UK. What was that experience like? Can you share any details with us? Any experience with the criminal investigation at all? Because these kind of cases would actually increase the curiosity of the audience in forensic odontology especially.
Yeah, so basically, forensic odontology, as this is a bridge between dentistry and law, so
Yeah,
I would want to maintain the confidentiality. I would not want to talk in detail about the cases,
absolutely.
but yeah, we have worked on bodies full of maggots. We have worked on burnt bodies. We have worked on adult bodies, on bodies of children. But yeah, we have worked on in such situations where we were very emotional, but like we had to do it because it was our job. So yeah, but on the criminal cases, I have not really worked on any criminal case up till now, but yeah, I plan to do so if I get any opportunity from the government, from
Yeah,
the university itself, or from anybody else, and from any private
perfect.
association. If anybody contacts me for any kind of bite mark cases, age estimation cases,
Yeah,
or identification cases, I'm always here to help.
perfect. All right, so uh, what's your research about? You've been researching a lot. You told me you were writing articles and all of that. Can you briefly tell us a bit about the research projects that you're doing?
So basically, as I already told you, that my research was very basic about forensic odontology because we have to start it from somewhere.
Yep,
Okay.
absolutely.
So basically, my research, the first paper which was published was about what are the most important teeth in forensic odontology.
Okay,
And then I had a paper which is about the undergrad curriculum and the awareness of forensic odontology. And
okay,
then I have a paper coming which is accepted but not published yet. So it is also about awareness of forensic odontology, but like different audience. And
perfect,
then about dental records. So
perfect.
yes, and then I'm planning a few more projects to work on, and then few more articles as well.
All right, perfect. All right, so my last question to you, Dr. Falak, would be, what do you think about this startup of ours, and any advice that you would like to give us?
I think you're doing a great job, and then this is going to help a lot of a lot of the young dentists.
I
And
hope so.
I must say, कि घर पे बैठ के you're doing something productive. That's really nice of you, and you're helping many others.
I
So
hope
yeah,
so.
it's really a good step.
Thank you. Thank you. Thank you so much, Dr. Falak. It was an honor talking to you. The interview was amazing. I'm sure even if you inspired one or two dentists to actually look into the field of forensic odontology, it would be an achievement for you and for me as well. So yeah,
Thank you
with
so
that,
much. It was pleasure giving this interview, talking to you, and I would be more than happy to help you anytime you want, or anybody else who wants any help regarding forensic odontology. I'm always here to help you.
thank you so much. Thank you so much, Dr.
Thank
Falak.
you. Good luck.
You too. Take care. Stay safe.
Take care. Bye.